Hey, it's Buck Joffrey here, back again with Dr. John Bridger. He is with Santa Barbara Podiatry.com. He is the foot doctor in town if you're in Santa Barbara, Goleta, Montecito, Solvang, all over the place. He is the foot guy around here. So thanks again for giving us the time to teach us a lot of this stuff, John.
Of course, thanks.
So let me ask you, this thing that I hear a lot about in Santa Barbara, a lot of friends of mine have, it's called plantar fasciitis, and it seems to be pretty common here in this area, despite the fact that everybody's super active, right? Why is that?
Yeah, so plantar fasciitis is really common in anyone, but runners and people who are active in particular, especially as they start to ramp up their level of activity. What can happen is they start to get pain in their heel.
Okay.
And that heel pain...
Does it happen suddenly? Like, is this your typical thing where you're just running along and you never had this pain and all of a sudden you're like, ooh!
Exactly.
Yeah.
It's an overuse injury.
Okay.
So
yeah.
it's oftentimes not associated with a specific trauma. There's not necessarily one incident that you can date it back to. And so you just notice one day that you're running or on your feet and your heel starts to hurt.
Okay.
And oftentimes people have had a history of this happening, but it goes away. And then eventually it won't go away. And if it lasts long enough, it can be really limiting in your activity.
So initially, what is it like when you're running and then when you rest, does it go away or does it?
So typically, it's actually after a period of rest, when you first get up, that it can be the most severe.
Oh, okay.
A lot of times people will notice it waking up in the middle of the night or first step in the morning, and that's often how it starts.
Oh, really?
Mm-hmm.
Okay, so it's sort of after rest, it's almost like it's not stretched out or something like that. Is
Yeah,
that kind of
exactly. Yeah.
So it's in the heel. It happens to a lot of runners. Let's talk a little bit about exactly what's going on. I know you had this model over here, but it's always nice to kind of think of what exactly this thing is. And what is a plantar fascia, first of all? What is that?
So the foot has a natural arch to it, which is supported by a number of structures: the joints, the muscles, and the plantar fascia. And this plantar fascia is essentially a rope-like substance that goes from the heel to the ball of the foot and towards the toes. And if you've ever seen twine kind of fraying, that's exactly what happens right here at the base where it attaches. And when that happens, it becomes very painful. And it's those first steps that you take oftentimes that are stretching it the most that are causing the most discomfort. And that's why initially it typically hurts with your first steps after rest.
So what does the fascia actually do? What is it normally supposed to do, and why does it get affected from running?
So it helps support the arch of your foot, which is so important with everyday activity, and it's even more under strain when you're running and you're doing high impact activities.
Right, so is it sort of taking some of the impact out of the running usually when you're...
Right.
Because it's kind of a rope?
Exactly. As you walk naturally, the structure of your foot changes a little bit, and that's normal. But when you get excessive pressure on the arch, you get excessive pressure on the plantar fascia as well, and then it'll begin to tear.
So when it happens, what should you do? If you start feeling this for the first time, is it something that'll just go away on its own?
So one of the most important things is to think about the support that your foot has and make sure. And then other things, you want to look at your activity. Have you gone from running 1 mile a week to 10 miles a week? Maybe you've gone a little too fast. And sometimes if you catch it early enough, you can make some simple changes that will allow it to heal.
Yeah, so when would it be a good idea, say, to, instead of just watching how it goes, how do I know if I have these kinds of symptoms that I should probably come in and see you?
Right, so if you're wearing a supportive pair of shoes and you're still having discomfort, then you need to come in and get it checked out, because a lot of times people will either ignore it or try to run through it, and that's not a good idea.
Got it. And so in severe cases, like what can happen? Like what's the worst case scenario?
Yeah, the worst case scenario, if you actually fray it to the point where you rupture it, that can be a real problem, really uncomfortable. And that's not so common. More common is just having a real chronic pain there. And that can be sometimes even more debilitating because you can't get around if you're limping.
Right. So as a podiatrist, how would you treat somebody with severe plantar fasciitis?
So the first step, most importantly, is getting the foot supported at all times. And I do that by padding and taping your foot. And so by taping your foot, I'm both supporting it, I'm also immobilizing the fascia to allow it to heal, and I'm swelling to that area. And so it's those three things that are really going to allow your body to heal the fascia.
Yeah. So what does the immobilization look like? Is it cast or something?
So luckily, I rarely need to use a big fracture boot or any casting because by simply taping the foot, you're immobilizing the fascia enough for the body to heal, but you can still continue in your regular gym shoes. So it's...
Right. So in worst case scenario, if it ruptures, what does that feel like? What is the symptom of that?
Yeah, rupture involves a lot of swelling, a lot of pain, and it's really impossible to ignore that. And at that point, if that happens, you need one of those big fracture boots for a long time in order to allow the structure to heal.
Could it require surgery?
Rarely does plantar fasciitis require surgery, only in the most severe instances, and oftentimes the surgery involves careful release of the fascia. So it's you might think that's similar to rupture, but rupture is not controlled, whereas surgically it's controlled.
Well, I think the bottom line is if you're a runner and you're feeling pain in your heel and it's not going away just by wearing a nice pair of shoes, it's probably time to come and see Dr. John here. And how can we get a hold of you?
So you can always reach me on my website, santabarbarapodiatry.com, and I'd be happy to see you.
Thanks, John.